Susan Hoke. I'm a nurse at Plymouth Endoscopy. I've been there for 22 years, and I've been with Dr. Fine all those years. Dr. Fine is very thorough and calm, and she really likes to teach. So I know when I first started, she would explain to me a lot about what I was looking at, and so she was just very influential, just teaching me when I was a new nurse. She's touched so many lives, and she's such a good doctor, and just predictable and clear, and it's just nice to have that kind of communication from somebody. So she's just been so great to work with.
I'm Alex. I am a endo nurse at Plymouth, and I've worked with Dr. Fine for 3.5 years. Dr. Fine just provides such amazing care for all of our patients. I love that she takes extra time with each one to make sure that they're comfortable, warm, not having any pain. So I think that makes a huge difference in our patients' experience here. That's why I had my mom come to her for her colonoscopy, because I knew Dr. Fine was the best one for the job. I feel like every day, anytime I'm in a procedure room with her, anytime I see Dr. Fine, she just always has such a bright, warm smile, and I know that it'll be a good day, good conversation. The donuts on Fridays, when she's working, are always amazing. Huge donut fan over here. And I love the conversations in the room. She always gives great recommendations for books or movies or different places to travel. And I just love catching up with her every time.
Well, I'm Teresa. I'm a nurse at Plymouth, and I've been working with Dr. Fine for like 1.5 years now. When I first started, my first time being in a room with her, she made it a point to go out of her way to make me feel comfortable. This last time that I was with her, we were talking about her retirement and where she's going next, and one of the things she mentioned was just taking the time to just slow down. We have such a fast-paced career and just life in general, so just take the time to slow down every once in a while and just kind of appreciate what you have. She brings donuts every Friday that she's working. That's always a nice little treat to come on to.
I'm Amy Strange, and I have worked with Dr. Fine for 13 years as a nurse at Plymouth. I think just overall, I enjoy just the times I would be in the procedure room with her and get a chance to work with her, but then also to enjoy getting to know her a little bit more personally. And I always think of books and reading when I think of her, and I feel like I was given many good books to read. I think I will just miss being able to see her, saying hey, and kind of just getting to catch up and see what's going on in her life, and I'll miss that just kind of steadfast, calming presence that she brings. She'll be greatly missed, but just enjoy your travels, go golfing, read some books, be in those golf leagues only with the kind golfers though.
Dr. Fine has had a tremendous impact on MNGI, and as well as being my colleague. We met when we were both GI fellows at the University of Minnesota, and had an opportunity. We were in the same fellow class. Dr. Fine, myself, and Dr. Hansen were the 3 fellows that year. And we had a lot of opportunity to overlap and work together and learn about each other. Dr. Fine has given a lot of contributions to patient care here at MNGI, and she will be missed by many people. During the years, I worked very closely with Dr. Fine, particularly in the early part of our career. We covered the same hospitals, so we were on the same call rotation. We shared a lot of patients. We worked out of the Plymouth location together for basically our entire careers. So we had a lot of opportunity for overlap and patient care. So in addition to being a great caregiver and clinician, Dr. Fine took on a large leadership role in MNGI. After we had started the PillCam program, Dr. Fine became engaged in that and then became the leader of the PillCam focus group for many years and brought in others behind her to fill that gap as she moved out of that area. So that was a great contribution that she gave to the organization. Dr. Fine's character was really exemplified by the patients that she took care of and the comments that we got from patients about how much of herself she invested in their care. And that's something I greatly respect, and I know that MNGI will miss it. I know that Dr. Fine's looking forward to retirement so that she can even expand the work on her golf game. That's a passion of hers that I'm sure she will enjoy, and I hope she stays in touch with all of us.